Hi, you're listening to Dr. Raj on the Lifestyle Talk Radio Network. I'm your friendly, board-certified orthopedic surgeon, and an orthopedic surgeon is a surgeon who also operates on joints, bones, tendons, ligaments. Now, the topic today I'd like to start with is obesity. We all know obesity is an epidemic, and many people are dying from medical-related issues. Well, there's something worse with respect to orthopedics. What about destroying your life and living as a prisoner to your own body? Obesity affects our joints significantly because our knees, our hips, our ankles, and our back are weight-bearing joints. So every extra pound you have is 5 pounds of force that's taken with every step through your knees. And what happens is technology's changed now. I mean, it's amazing in the environment we live in. I mean, we've got all these advances in medicine. You know, the first person to live to 150 is deemed to have been born now. Prudential has signs out and billboards out stating that, you know, 1 out of every 3 people right now who are born now will live to 100. So we are going to live longer, but guess what? Our joints are only going to last so long. And as a society, we've all changed. I mean, we've become, compared to 20 years ago, and I don't want to date myself, but 20 years ago, we used to be a lot more active. We didn't have the internet. Our kids would be playing outside. So our kids basically and people were more physically active and forced to entertain themselves via sports, via being active, versus sitting in front of a computer, which we're all susceptible to now. So what has happened is basically with all of this change in our technology, people tend to be a lot more sedentary. So as in general, we look for quick fixes. I have patients who actually come to me and say, can you just surgically fix me? That's our mentality now. No one wants to really work as hard. Now, our cartilage is genetically programmed to wear out. I mean, we all have different varying degrees of genetics on the strength of our collagen and our cartilage. But there's 2 factors. There's genetics and environmental. So our population's becoming heavier. Muscles aren't protecting our joints. So what's happening is our joints are wearing out at younger and younger ages. What that means is people are having unnecessary joint replacements being done at younger and younger ages because they just can't bear the pain. Once you have a joint replacement done in your 30s, there's only so much bone, only so many times you can revise it before you're stuck in a wheelchair, and that's the reality. So what I am saying now is we need to be much more proactive as a society to preserve our joints. And what that means is, you know, recognize that obesity, it's one thing to, you know, die from medically related issues, from blood pressure or strokes, but it's a second thing to live as a prisoner in your own body for years. So imagine if you had your joints replaced twice and your doctor said at the age of 40, I can't replace your joints anymore, you're stuck with what you have. And imagine living till 100. I mean, that's in itself. I've got a patient of mine, and she's a sweet, sweet lady. She came to me about a year ago. She's 37 years old. She was a salesperson, and she gained a lot of weight. I mean, for the exact same reason. She was in front of the computer a lot. Life was easier. She wasn't as active. She had every excuse and she said, I'm young, and she didn't think about it, but she and her family all had bad diet habits. So what had happened was just suddenly she started having this pain in her groin. Her name's Karen, and she couldn't, she started noticing she could walk less and less. She had a 5-year-old and a 3-year-old kids, and she couldn't keep up with her kids. I mean, if you can relate to that, when you have active kids, because I've got a 5-year-old myself, and if you can't keep up with them, walk with them, she'd sit at a bench, and she was in denial, and she was hoping it would go away. Finally, she saw an orthopedic surgeon. Now, the problem with Karen is by the time she went in and saw someone, she was close to 300 pounds, and probably about 5'5". And the first surgeon who saw her just looked at her and said, come back when you're 60 and lose a lot of weight. I'm not touching you. See, that's the mentality we have right now, because joints only last for so long. And when you have this significant amount of weight, there's a risk of wearing it out a lot earlier, too. So that surgeon didn't want to incur any risk, or was fearful of malpractice or even a morbidity of doing a surgery of this nature. Second surgeon just walked in the room and again just said, you weigh too much. After getting 4 different opinions, she was very discouraged, and she was referred to me through a few different sources, and she came in. Now, I tend to understand the situation, and I looked at her, and I got these x-rays, and as I got these x-rays, the first thing I said is, she was bone on bone. She had no cartilage at all in her hip joint. And tears, I watched her tears. She had a walker in the room. A 37-year-old in a walker. She's a prisoner in her own body. She was on multiple medications. She was getting depressed. She was anxious. And what had happened was, as I looked at her, I said to her, Karen, I said, this is a relationship, an agreement between us. And what I want you to do is lose weight, and I'll do your replacement. Tears of joy came out, and I ended up doing the replacement, even though, to be honest with you, it's a risky surgery. And when you have a high-risk surgery, there's risk of dying, blood clots, and also failure of the surgery. So a lot of surgeons will shy away from this. She ended up having it done, but in doing so, I made an agreement with her. And it was a verbal agreement that she would lose weight and change her lifestyle. She came into me about 2 weeks later, happy as hell, but what surprised me and what made me happy was automatically she showed me her lifestyle change. Her diet has changed. And, she was able to walk and keep up with her child. So the point being is, I'm trusting the fact that she's going to continue losing weight, but on a simplistic basis, you can see how this epidemic of obesity for orthopedics is growing. You've only got so many times you can replace that joint. There's only so much metal you can feasibly walk on. So protect your joints now and get yourself conditioned, change your lifestyle, because there is nothing, dying is one thing, but living as a prisoner in your own body is a horrendous feeling, and I see it. So my message to you is, while you are healthy, be aware of what can happen before it actually happens. Change your lifestyle, and I hope you all live to 100. And basically, enjoy your life. This is Dr. Raj.